Good morning, everyone. So the Dads Caucus is here to really stress what's going on around the country, especially when it comes to parents, working families, children. And what we're seeing is a constant increase of prices across the board. As a dad that goes shopping almost every week for his family, I see those prices just jump. And it has got noticeably worse since Donald Trump became president. We've seen egg prices go up 30%. In my local grocery store, Avon's that I go to, eggs are now about $11 for a dozen, and then also about $16, $17 for an 18-pack. And if you're here in D.C., you might be lucky to find some at Trader Joe's if you get there early enough. But that's what we've been seeing, that consumer confidence is going down, inflation is going up, unemployment is going up. You're seeing a drastic decline in people's confidence in this economy. At the same time, you're seeing Donald Trump threatening tariffs that are crashing the stock market. That means people's 401ks. That means their retirements. That means their kids' college funds. So if you have a kid in a 529 account, you're seeing that go down right before your eyes. Additionally, you're having a situation where the Republicans here are capitulating on everything. And what they are ending up doing is that they're trying to pass a CR that doesn't do anything to combat avian flu or reduce the cost of living, which Donald Trump said he would do on day one, and he's failed to do that. They actually have a CR that cuts $27 million from inspectors that are supposed to investigate the avian flu to make sure it doesn't spread and create more chaos. Additionally, right now, Ways and Means, I'm on the Ways and Means Committee. Ways and Means is meeting behind closed doors this week on how to give billions of dollars in tax cuts, or if not trillions, actually trillions, just to keep the tax cuts the same, about $4.7 trillion. You add in anything extra, you're going to see even $8 trillion. And that's all to give tax breaks to the ultra wealthy, the billionaires, as well as the largest corporations in the country, while cutting Medicaid that people rely on. And now we see Elon Musk going after Social Security. You're going to have an impact. Most people don't know this. Here's a fact that most people don't know. Social Security is the largest anti-child poverty program in this country, because kids who lose a parent, that they get the Social Security benefits that they would have received later in life. They get it to help them in their time of need. So when you go after Social Security, you're not only impacting seniors who are in retirement, but also children. So this is one of the things that we're going to keep pushing back on. We want to sound the alarm that Donald Trump and the Republicans are going to make things worse for parents. They're going to make worse for mothers and fathers and children. Unfortunately, the Republicans don't seem to want to work with Democrats when it comes to the CR. They don't want to work with Democrats to even putting forward policies that would help to reduce the cost of housing, childcare, and make America affordable again. So we're going to keep arguing and going out in the community to talk about it. But people are talking about how things are getting worse. I put up a story about grocery shopping, and one of on my social media, and somebody goes, "I'm raising my 5 grandkids, and this week my bill for groceries was $450. $450 for one family's grocery bills." And then another one says, "Prices are even higher than a month ago." This was 3 days ago. Then a couple of months ago, for sure. My grocery shop is painful. So this is not limited to certain parts of the country. This is widespread, and we got to keep trying to make things affordable for families across the country. With that, I want to hand it over to Dan Goldman. He was one of the founders of the Dads Caucus. Dan.
Thank you very much to Congressman Gomez for his leadership of the Dads Caucus. And we are here on the day that we will be voting on what should not be called a CR, a continuing resolution, because it is not. It is a partisan Republican funding bill that will continue to cut essential services for families in this country, for working Americans. Just as a couple of examples, this bill will slash rent subsidies by more than $700 million. It will cut funding for non-defense programs and services by as much as $15 billion. It does not reauthorize theft reimbursement for food benefits for SNAP. It does not fix the 9/11 World Trade Center Health Fund formula. It does not address and update the funding formula for Medicare, which makes it even more costly and difficult for doctors to provide care for Medicare patients, which ultimately will mean that Medicare patients get far worse and in some cases no treatment. It leaves 32,000 households at risk of homelessness because of the cuts to housing assistance. It guts state and local law enforcement. It cuts significantly an emergency food program for food banks. The list goes on. But the most important thing that people need to understand is this bill is a blank check, maybe not check, a blank slate for Elon Musk to slash and burn our government. Because this bill does not have the joint explanatory statements that comes with a proper budget funding bill that designates where the money must be spent. And so it gives Elon Musk broad discretion as his own inexperience, lack of government experience, lack of understanding of how these government programs work, completely arbitrary cuts that have nothing to do with waste, fraud, and abuse. It gives him full control and discretion to do that as much as he wants. And you don't have to take my word for it. Go look at the comments from the House Freedom Caucus, which, as you all know, never votes for a continuing resolution. But they're in support of this. Why? Because they know that it is not a continuing resolution. It is a partisan Republican bill that freezes spending well below the agreed upon limits in the Fiscal Responsibility Act and gives Elon Musk total authority to slash and burn our government. And that is the big difference here. And that will ultimately hurt families because Social Security is on the block. Medicaid is on the block. Food benefits like SNAP on the chopping block. Donald Trump promised to help working Americans on day one. The only thing he has done is to help himself, Elon Musk, and their billionaire buddies use the government for their own corruption at the expense of the American people. And this bill today does even more of that. And that is why Democrats will be united in voting against it and why we urge and believe that our colleagues on the other side of the Capitol will stand up to this terrible bill for the American people. And it is the Republicans who will be responsible for any consequences, because if they want Democratic votes, then they need to take Democratic input, and they did not. I'm now going to turn it over to the doctor in the House, my good friend Raul Ruiz from California.
Thank you so much. It's wonderful to be here. And I, too, want to thank Representative Gomez for getting this press conference together and for all of you for attending today. I'm Congressman Dr. Raul Ruiz. I represent the southeast corner of California. But for the purposes of this conference, I'm a proud father of twins. They're 9-year-old girls. They're the joy of my life. They're the loves of my life. And being a father is more important for me than any other title that I have. Equally as important as husband, in case my wife's watching. And so those two titles I carry with pride and with joy. And so as a dad, one of the things that concerns me and many fathers around the country is the health and safety of our family. We know that the two P's, the protect and provide, are the most concerning things that we need to address in terms of the fundamental basics, and also to nourish our family, to help them grow and our children and us as a family into a healthy family, productive, following our purposes and supporting one another. And we often talk about that as a family with my little girls and check with our check-ins to see how they're doing. And health is a fundamental aspect of keeping our children healthy and safe. And the budget framework that they've proposed that will pave the path to cutting programs in order to give billions in tax breaks to billionaires is a threat to the health and safety of all of our families. I am particularly concerned with their attempts to cut $880 billion from the Energy and Commerce Committee, of which I sit on, because we know that they cannot reach $880 billion without having to fundamentally cut or change Medicaid. We also know that there are different ways that they're going to attempt to do that. One is work requirements. The other is block granting. The other is decreasing the reimbursement percentage of the federal government's portion of those payments. The other is caps on per capita within the different states. All of these different policies proposal has one goal in mind, which is to decrease the usage of Medicaid from individuals. In other words, cut Medicaid expenditures. In other words, cut Medicaid. In terms of the work requirements, they understand that hardworking parents, especially single moms who are working two jobs, taking care of their kids, find it very difficult to comply with the onerous application paperwork process to keep their Medicaid intact. They have seen in states that have implemented this that parents have just dropped off the queues simply because it was very difficult to navigate, and it was hard for these hardworking parents to find the time and the wherewithal to continuously turn in these applications. The other issue with these work requirements is that you have a lot of communities that have high unemployment rate, like in my district, where if they cannot find a job, then they're going to be penalized for no fault of their own, given the current state of the market. And God knows that our economy, it has taken a drastic wrong turn or a turn for the worse since Donald Trump has been president, and for no fault of their own, many communities are going to be facing high unemployment rate as well. So just to give you a sense of the importance of Medicaid in keeping our families healthy and safe, in California alone, 43.1% of all children use Medicaid. In my district, to give you a sense, 60.8% of children are on Medicaid. In California, 40% of moms giving birth and their newborn babies utilize Medicaid. So our wives and our children, our newborns, need Medicaid, use Medicaid. And so if you lose Medicaid, and by the way, our parents, the elderly, people living in nursing homes live on Medicaid. Oftentimes in different families, the elders live with us, or we are also responsible for our parents in their elderly years. So if we lose coverage of Medicaid in California, certain children with disabilities, such as children under the age of 19 who are disabled and living at home, will lose health care and the Medicaid coverage. Our parents, the elderly, as well as disabled adults, such as those who are institutionalized or eligible for home and community-based service, will no longer be able to receive that. Our wives who need, and sometimes men, who need breast cancer treatment, our wives, daughters need cervical cancer treatment, and if they do not have any other treatment coverage, then they won't be able to get it because they have Medicaid. If they have no other way of covering those treatments, and without Medicaid, they're going to go without those treatments. Postpartum moms whose pregnancies ended in the prior 12 months will no longer have health care coverage. And California also will consider reducing income eligibility levels for mandatory eligibility groups such as children, pregnant women, and parents and caretakers. Look, if they have block grants and give a cap to different states, states are going to scramble. The first thing they're going to do is they're going to cut reimbursements to physicians. Therefore, physicians will will be less likely able to accept patients on Medicaid. So in your healthcare deserts, there will be even less access to healthcare coverage. The other thing that they're going to do in order to cut costs is they're going to then cut the eligibility of the people who can accept Medicaid. The third thing they're going to do is they're going to start cutting the benefits that people on Medicaid could cover. They could cut mental health services. They could cut obstetric services, dental services, hospice services, etc. So the end goal, as I said, for all of these different attempts to fundamentally cut Medicaid is to reduce access and take away access from American families. And that's very concerning for me as a dad, and I know for many dads across the country, because their primary goal is to provide, protect, to ensure the health and safety of their family. And with that, I want to turn it over to Representative Kennedy.
Thank you. Thank you, Doctor. It's always good to have a doctor in the House. First, I want to thank my colleagues for their ongoing efforts, for Congressman Gomez for organizing the Dads Caucus along with Congressman Dan Goldman. Also, again, recognizing Dr. Ruiz, Congressman Ruiz, and Congresswoman Jayapal, the head of Mama's Caucus, who's joined us as well. I'm sorry. And I want to recognize all of the incredible parents, grandparents, family members, and caregivers who selflessly dedicate their lives to the betterment of our nation's children. I have the privilege of representing Western New York's community here in the nation's capital. But by trade, I'm an occupational therapist. My work as a healthcare practitioner, helping the most vulnerable among us, was inspired by my mother, who was a nurse, my grandmother, who was a nurse. It helped me focus on people, helping others, and becoming a public servant myself. However, my most rewarding job is being a dad. My wife, Katie, and I have 3 beautiful children, and each day we work to ensure that we're leaving them a world where they can thrive. And so today we stand here united as members of Congress, but as parents as well, to speak up for working families across the nation who deserve so much more than what the Republican budget proposal offers, who know that this budget is a giant step backwards for kids and their well-being across America. The GOP budget is nothing short of an assault on the middle class and hardworking families across this country. It prioritizes tax breaks for billionaires and puts Medicaid and food assistance on the chopping block to pay for them. This budget isn't about balancing the books. It's about continuing to put the ultra-wealthy ahead of everyday Americans. As parents, we know the pressures of raising a family in this economy. We hear it from our constituents every single day. They're struggling to juggle health, child care, caring for aging parents, skyrocketing grocery bills, and rising housing prices. American families are facing a cost of living crisis, and the Republican budget will only worsen it. The fact that Republicans are prioritizing tax cuts for the wealthiest individuals, trillions of dollars in tax breaks for billionaires, while turning their backs on struggling, working families, is a betrayal of everything this country stands for. These families didn't ask for more hardship. They didn't ask for their livelihoods to be traded away so that billionaires can get even richer. Yet that's exactly what the Republican budget proposal will do. Instead of addressing the real needs of families, this proposal will undermine the very programs that are keeping families afloat, programs like Medicaid, food assistance, and child care funding. It cuts up to $6 billion in child care funding, leaving parents with fewer options for affordable care. It guts the safety net that working families rely upon to survive. And again, for what? To give tax breaks to people who certainly don't need them. Billionaires and the ultra-wealthy in this country. We are better than this. We can and must do better for our children, our families, and the future of our nation. As members of the Congressional Dads Caucus and Mama's Caucus, we are fighting for the policies that actually work to help families. While Republicans are proposing decimating the social safety net, we are advocating for expanding the child tax credit, a lifeline for so many families, which the American Rescue Plan showed can significantly reduce childhood poverty. By enhancing the child tax credit, we can give families more resources to cover the essentials: groceries, school supplies, diapers, and health care, so they can make sure their children have what they need to thrive. We're demanding a national paid leave program because it's unacceptable that the wealthiest country in the world, only 27% of private sector workers have access to paid leave. No parent should have to make the choice between caring for their children and families and keeping their job. And we're fighting for affordable, accessible child care. Our children's future depends on the care and support they receive early in life. Yet the cost of that care is becoming more than many families can afford. We cannot afford to cut child care funding when so many parents are already stretched thin. Instead of giving handouts to the richest of the rich, we should be investing in the future of our children and our families. So we're here today, speaking as fathers, as parents, and as representatives of the people who need us to fight for them. We're not going to rest until we pass a budget that puts working families first. That's what our families deserve. And now I'd like to pass it over to the head of the Mama's Caucus, Representative Tlaib.
Thank you, Representative Kennedy. I'm here as a member of Dads Caucus, and I know for many of our dads, they care about prenatal care. They care about maternal health. I come from a city that has one of the worst infant mortality rates in the nation. And when we think about what are some of the biggest barriers, it's access to health care and coverage. No one family ever plans to get sick. And Medicaid has been a lifeline. For many of our dads, we know that long-term care for our parents, for even some of our grandparents, relies heavily on Medicaid. And so it is incredibly important to understand Medicare, Medicaid, even Affordable Care Act, which is all going to be impacted by the proposed nearly $1 trillion cut to the Energy and Commerce Committee that oversees health care in our country. But to have parents come up to us already, some of them with children with special needs, petrified about getting coverage cut, just horrified. Even the anxiety and fear that is being injected into the American people across the country. One of my colleagues on the other side, 62% of his residents depend on Medicaid. This is not should not be a partisan issue. We have a broken healthcare system. I call it sick care in our country. Until we have the courage to really address it head on, many people are relying on Medicaid and Medicare. So it's incredibly important, as the Dads Caucus talks about a lot of the safety nets that are not available right now for our people, to watch colleagues cut the one thing that many of our families depend on. I don't think there is one congressional district that does not depend on Medicaid. And it's incredibly important. So for all the fathers out there that are fighting, speak up. Us mamas need you to all speak up. And I know the Dads Caucus has been incredibly effective in doing that. We know that this, again, is not, a district like mine is not the only one impacted. I intentionally look it all up because I want to know, will their families be impacted? And they do. Every single congressional district will be impacted by cuts. But thank you so much to Congressman Jimmy Gomez. When he created the Dads Caucus, it really uplifted much of the work that many of our families have been working on, and really leading the fight and trying to, again, address the broken healthcare system in our country. Thank you.
Now, any questions? Go ahead.
I want to ask about the continuing resolution. House looks like it might be able to pass it today.
Yeah.
Would it be helpful for your Democratic colleagues in the Senate to say more forcefully that they oppose this bill?
Yeah, absolutely. I think the Senate needs to speak up and show stronger leadership when it comes to the messaging on this bill. If not, it's just going to roll right on through. Here, I think you all have seen the Republican caucus be in the House be more unified than I've ever seen them. But when you have an enforcer with almost half a $1 trillion war chest to make anybody who gets out of line get in line for the Republicans, they're going to fold pretty quickly. So, but yeah, we need the Senate to show more leadership to speak up against it. Because if not, of course, we know how the Senate works. People are going to be flipping pretty quickly.
To follow up with Nick, do you see that all Democrats, or are you hearing that all Democrats are going to vote against the CR and just PRs? There's not going to be any one or two that side with Republicans?
Well, so far I'm hearing everybody is against it. But you never know if it's going to... there's some that I would say it's always a political calculation, right? Even if they're against it, are they going to leave themselves open if it's going to pass anyways? So that's always a concern. But right now, people are inclined to vote no. But you never know when the day of the vote.
Related to that, you guys are up here saying that this CR, it's a sky is falling situation, and it's going to cut all these public services across the country. To have Democrats vote for it, and if they voted for it and they put it over the finish line in the Senate, doesn't that totally undermine your argument? Because Republicans are just going to go, well, if it was so bad, why'd 8 Democrats vote for it in the Senate, or whatever, the handful in the House? It couldn't be that bad if these guys are voting for it. They're Democrats.
Yeah, no. Sometimes we, although there's technically 2 parties in Congress, there's actually 4 sometimes, right? Democrats in the House, Democrats in the Senate, Republicans in the Senate and the House. We will, but you're absolutely correct. If they have to see the CR as laying the groundwork for passing budget reconciliation and the trillions of dollars that they're going to hand out in tax breaks. That's what it has to be kind of viewed as. If not, they're going to, if they view this as a one-off, I think they're going to, they might have more people in the Senate vote for it, more Democrats. So Senate leadership has to kind of push back and try to show some leadership and try to whip some votes, in my opinion. I'm not the majority leader.
Yeah, but one of the things that overwhelmingly I hear from many of our colleagues in the caucus is about, we fought so hard for the PACT Act, and one of the things is not funding the actual implementation of the expansion of health care for our veterans was overwhelming one of the things that I heard from colleagues from all different political backings. I can tell you 2 million veterans got in the pipeline that were exposed to Agent Orange toxins. About 500,000 are still in the process. And basically what this budget proposal, because it's really more of a budget proposal, they don't fund it at all. They pretty much cut the funding. And so that's been one of the things that continues to come up of the shock. We did not expect them to cut veterans health care at $29 billion. I mean, this is one of the main programs that many of our veterans have been waiting for. Again, many of them exposed to toxins during, times of war, and this is a promise that we made to them. And to have a 1-year complete cut of that program while they're sick and dying is something that many of my colleagues are talking about.
I would just say simply, I believe the Democrats, under the leadership of Hakeem Jeffries, are united against this bill. I believe we're going to demonstrate that today based upon what the conversations are taking place on this. This is a bad bill for America. This is going to hurt families across America. This is going to cut vital services, health care, Medicaid, services that people rely on from the early stages of life, like early intervention, childhood treatment for kids with disabilities, to care for our families in long-term care facilities, be it our parents or our grandparents or loved ones or neighbors, and everything in between. This is going to give a green light. The passage of this is going to give a green light to the devastating cuts that Republicans want to perpetrate upon the people of this country. And the Democrats are united against it under the leadership of Hakeem Jeffries.
All right, everyone. Thank you so much for coming. Appreciate it. Thank you.